Good afternoon. Welcome to the Chancellor's Leadership Forum on Diversity and Inclusion. Thanks for joining us today. Before we begin, please note that we are dedicating time during today's session to answer your questions. We know that the topics we cover are very important and we appreciate your engagement, but please be mindful of our UCSF pride values and be respectful in your comments in the Q&A. We will try to answer as many questions as we can during the time allotted. Thank you. And now it's my pleasure to introduce UCSF Chancellor Sam Hawgood.
Thank you, Lisa, and good afternoon, everyone. Welcome to the 14th Annual Chancellor's Leadership Forum on Diversity and Inclusion. To begin, we would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support. We also look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Now, today's forum is an important part of our commitment to communicating transparently with the UCSF community about progress and challenges in our anti-racism work and other important efforts to make our campus and health system more diverse, more equitable, and more inclusive. In today's session, we will hear highlights from our three newest cabinet members. Then Vice Chancellor Navarro will share results from the UCSF-wide climate survey, which was conducted this past fall to measure how our learners, faculty, and staff feel about UCSF as a place to work and learn. And Dr. Camara Jones, the UCSF 2021 to 2022 Presidential Chair, will share her observations about the progress of our anti-racism efforts and how we might achieve our goals going forward. So this is a full agenda. We are holding time at the end of the presentations for your questions. Now I'd like to speak about the Cabinet's commitments. I, along with my Cabinet and their direct reports as the senior leadership team of UCSF, am committed to improving diversity, equity, and inclusion and anti-racism on our campus and in our health system. Today, I will share just a few of the deliberate actions we are taking to demonstrate this commitment. Although we realize that it will take time, one goal is to have our leadership diversity match that of our community. We know that using best practices to avoid unconscious bias helps us select outstanding individuals from a diverse pool of candidates. A process measure adopted by the Cabinet to hold us accountable, which will be reviewed in June and then on an ongoing, consistent basis, is to ensure that all recruitments for a cabinet-level position or of their direct reports use an equity advisor. We selected this measure because our hypothesis is that equity advisors will help us follow the best non-biased hiring practices. This should ultimately result in our desired outcome of increasing leadership diversity. By adding the rigor around checking whether this is happening or not, I am confident that my team is aligned and we are driving progress. Another area of focus for my Cabinet is the restorative justice pilots that were launched in February. We believe these pilots, which focus on community circles, can help build and strengthen relationships in our community, as well as address and repair harms that may have occurred. We see this work as helping to improve the sense of belonging for all, especially for those who have felt unheard or unrecognized at UCSF. The effectiveness of the pilots will be measured using pre- and post-assessments completed by participants in the community circles. We will learn and expand based on the success that we achieve. The last area of focus I would like to mention today is our goal to increase UCSF's procurement spend with small and local diverse businesses. We want to support these businesses by increasing our overall spend from them by 50%. Cabinet members are working with the Anchor Institution Initiative and Supply Chain Management to analyze their procurement spend with their direct control. These conversations are leading to a greater understanding of current challenges, such as the availability and ease of access to small, local, and diverse businesses. These challenges are being addressed or plans being created to address them as they are discovered. In closing, please know that I and my cabinet members are actively engaged in supporting and tracking our DEI progress. We are holding ourselves accountable to you for making progress, learning, and refining our actions as we go. Now we'll hear from the three newest members of the cabinet about some of their thoughts around DEI and anti-racism in their areas of responsibility. If you haven't yet been introduced to them, Dr. Nikkei Blake joined UCSF in December of 2021 as Vice Provost of Student Academic Affairs and Dean of the Graduate Division. A leading voice on issues of equity and diversity in higher education, Dr. Blake previously served as Senior Associate Dean for Admissions and Student Affairs in the Graduate School of Biomedical Sciences at the University of Texas, San Antonio. There, she expanded recruitment efforts to attract students from historically underrepresented backgrounds and gained financial support for retaining, supporting, and nurturing a more diverse student body. Suresh Gunasekaran joined UCSF in March of this year as the new president and CEO of UCSF Health. He also oversees our health system's expanding network of affiliated healthcare organizations throughout Northern California. Previously, Suresh served as CEO for the University of Iowa Hospitals and Clinics. He has more than 20 years of experience in healthcare administration and information technology with a focus on quality, safety, patient service, collaboration, and operational excellence. We will also hear from Erin Gore, who joined UCSF in February of this year as our Vice Chancellor for Finance and Administration. Prior to joining UCSF, Erin was the Executive Vice President of Growth Initiatives, Strategy, and Communications at Wells Fargo Bank. At Wells Fargo, she led in the areas of strategic planning and modeling, public relations, policy development, capital planning, change management, crisis communications, and financial and treasury management. Her knowledge of financial management and administration is grounded in the leadership principles and experience that she gained as the Associate Vice Chancellor and Chief Finance Officer for the University of California, Berkeley. So let's begin with Dr. Blake. Dr. Blake, please go ahead with your comments.
Thank you, Chancellor Hawgood, and good afternoon, everyone. I spent my first 100 days as Vice Provost and Dean of the Graduate Division on a listening tour with the many stakeholders within the Student Academic Affairs and Grad Division and with other UCSF partners that interface with the SAA Grad Div. As you might imagine, these conversations, I heard a lot about the pride points and values as well as the challenges of our colleagues. I heard that we are committed to being inclusive, that we are innovative and creative, and that we are strong advocates of our students. I also learned that SAA Grad Div already embraces the concepts of diversity, equity, and inclusion with the transformative work that many of my leaders have been engaged in. I think about the work of our Assistant Dean, Dr. Deanne Duncan, and her team in guiding conversations around racial trauma, and then developing curricula to inform and engage our students and faculty. I think about the first gen and restorative justice work of Elise Alderson and our AVC, who is the AVC of Student Life, and her team. I think about the incredible work of Dr. Jean Stanford and the student health and counseling team, which has been centered on the health and well-being of our student population. And finally, I think about the work of Nalidi Saul, our OCPD director, and her team with their NSF-sponsored work on inclusive mentoring. As we move forward together, we will collaborate as an enterprise to fully embrace the values of justice, equity, diversity, and inclusion in every decision, every process, and every strategy in which we engage. In doing so, we will foster a learning environment that will train the next generation of inclusive and visionary leaders. With that, I'm going to turn it over to Dr. Suresh Gunasekaran, who is the president and CEO of UCSF Health. Suresh?
Thank you, Dr. Blake, and very good to be with all of you here. I haven't made it to 100 days. I'm about 30 days behind, maybe 35, 40 days behind, but I've really enjoyed getting to be part of the UCSF community. And it's been wonderful to be able to travel to all of our campuses to meet all the wonderful people that make UCSF Health what it is today. As I reflect on diversity, equity, inclusion, my first observation is whether it's at the cabinet level or at the senior team of UCSF Health or the broader leadership team across the organization, we have a significant focus on making sure that we advance our agenda around diversity, equity, and inclusion. I see so many different leaders engaged in thinking about how we can address these challenges. On a personal level, it's been very meaningful to me. I grew up in Nashville, Tennessee, and my dad was a professor at Fisk University, a historically Black college in Nashville. And although some of his greatest successes are the numerous students of color that he advanced to medical school and graduate school and all of these things, we lived with a reality that there were just structural obstacles that many of his students and many of his families faced that others within the community just did not face. And so on a personal level, it's really gratifying for me to be a part of a leadership team that's so committed to advancing progress in this realm. However, in joining UCSF Health, I see the gaps ahead. I think that when we think about the mission of UCSF Health and promoting patient care excellence across our community, one of our greatest challenges is in the form of healthcare disparities. And when you look at the data, it is sobering, and it shows the work that still remains for us to do better. And we know that we have to meet the community where they are. We know we must transform ourselves to be better at listening and modifying our care processes in order to meet their needs. And secondarily, I continue to see progress in our campus climate and culture, as well as in the employee engagement of those within the organization. But we still see significant gaps amongst our team members that are of diverse backgrounds. And so as I think about what I can contribute to the leadership team, I'm very focused on collaborating with all of my colleagues and all of you on advancing our agenda around reducing and eliminating healthcare disparities, as well as making sure that we have the most inclusive environment to accept the great strength that we get through the diversity of our employees and apply it to all of our missions, but most of all to patient care. Really appreciate having the opportunity to be here, and I'll hand it over to Erin Gore.
Thank you. And I too am excited to be here, having joined, as Sam said, the campus in February as the Senior Vice Chancellor for Finance and Administration. I am so grateful to have joined the UCSF community and for myself rejoining the University of California. As many of you know, and many are part of, I have a broad portfolio from transportation, facilities, finance, HR, police, and IT, just to call out a few. Like my colleagues, I have begun a listening tour, which I am committed to continuing through the summer so that I can go deep into the areas we're discussing here today, including diversity, inclusion, equity, accessibility, anti-racism, and belonging, and really understanding your ideas and reflections so that we can become the organization we aspire and talk about. I also just want to call out, I've heard a lot in my early days of the listening tour on the significant impact in the last few years from Asian hate, racial tensions, and overall COVID exhaustion. My team invited Dr. Camara Jones, who we'll hear from a little bit later in our program, to join our finance and administration team. And as a group, we've been reflecting on Dr. Jones's words and her challenge to the group as well as me to really dig deep and look where are there policies as well as practices that perpetuate non-inclusivism as well as racism. We have taken that challenge seriously and are working on that right now. I am proud of the work that finance and administration has undertaken so far. The Chancellor highlighted the supplier diversity work that we are working on with a number of teams across campus. We also are working hard on the Anchor Institution and really working on all of our committees to make sure they reflect the community of UCSF. Additionally, HR has been listening to feedback and working hard on additional career pathways, as well as how do we launch additional leadership support to make sure that our leaders have the tools that they need to remove systematic barriers. Finally, I want to just do a small plug to have everyone take the time to complete the Gallup engagement survey that is going on right now, which is an opportunity for us to really hear where we are and where we need to better support you 2 years after this pandemic. As a leader over a diverse portfolio of services that the UCSF community interacts with every day, we have great potential and great responsibility, and I take my role in that work very seriously, and I look forward to listening with you and engaging in this conversation. I think I turn it back over to Renee.
Yes, thank you very much, Erin. And to all of our new leaders, thank you very much for your comments. I'm Dr. Renee Navarro, and I serve as the Vice Chancellor for Diversity and Outreach. And it's my privilege now to introduce to you our Presidential Chair for 2021-22, Dr. Camara Jones. And as you know, we've been working on our anti-racism initiative and understanding how racism shows up in our policies, our practices, and our procedures. Dr. Jones has been a stalwart national leader, and we're so pleased to have her with us during the time of her presidential chair. She's a family physician and epidemiologist and the past president of the American Public Health Association, whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of our nation and in the world. She recently completed a role in the 2021 Presidential Visiting Fellow at Yale School of Medicine, and in 2019-20, she was the Evelyn Green Davis Fellow at Radcliffe Institute for the Advanced Study at Harvard University. Dr. Jones served 14 years as medical officer at the Centers for Disease Control and continues as an adjunct professor at the Rollins School of Public Health at Emory University and a senior fellow and adjunct associate professor at Morehouse School of Medicine. In addition to her many other accomplishments, she has today been notified of another distinguished honor. She has been elected to the American Academy of Arts and Sciences. Well deserved, and it's such a privilege to have you here, Dr. Jones.
Thank you, Dr. Navarro. And I would like to just briefly share some of my observations and recommendations while I've been here for the past 10 months at UCSF. So, hold on. So the first thing is that there are, as you've already heard from the 3 newest cabinet members, and as you know, many talented, earnest, passionate, effective people and in all parts of the UCSF enterprise. However, there is a fragmentation and lack of coordination across different parts of our enterprise, and also some passive resistance to anti-racism efforts that I heard about, reflected, for example, in comments like, overheard comments, not directly to me, but overheard comments from, for example, a white professor who might say, oh, I guess there's no room anymore for white men at UCSF. There have been, when I first got here, recent departures of 2 very high-profile Black women faculty, and now there are 2 more. So recent departures suggesting either UCSF is just, producing people and then spreading them out to the world, or not trying enough to hold on to the gems that they have. I noticed that there were differences in compensation for the anti-racism work being engaged by the School of Medicine, and the differences matter between your status, your employee status as faculty versus staff. And I think there is quite a hard hierarchy across all of the schools and across the health system and the graduate division between staff and faculty. And I think it's a harmful hierarchy. I know there are different roles, but they're all employees with different roles. I kept hearing about difficulty with accessing data across several domains. So just like who is here, some of the human resources, and levels of hiring, how financial resources are distributed across the institution, across schools, and the like. Marked differences in resources between the schools. Of course, everybody said that the School of Medicine is the huge player, financially and resources and everything, which is going to get to one of my recommendations. We are all family. And so maybe there needs to be a better way to share, not financial resources, or maybe including financial resources, but curriculum resources and agenda resources and the like across all of the schools, the graduate division, and the health system. I noted a sensitivity around talking about the police presence on campus and in the hospitals. When I would raise the question, sometimes it was quickly tamped down. I also noticed that anti-racism training that has been initiated by several of the schools has not yet been fully extended to all of the clinical faculty and all of the clinical settings. And I wonder and worry a little bit about our trainees, especially the medical students, dental students, nursing students, pharmacy students, graduate students who come up with a certain awareness or sensitivity, and then they get into a clinical setting where they hit the hard reality of the old way of seeing things and doing things. I welcomed the use of diversity statements in hiring and in some, promotions and evaluation thing, but recognize that there's an inconsistent use of diversity statements across all of the different parts of UCSF, and also inconsistent systems of accountability. I noticed that there's no shared definition or framework around anti-racism across UCSF, and a fear of getting it wrong by many people who want to be engaged in anti-racism work, but feel a little gun shy when their best efforts might be critiqued as being less than what was expected, when there's a notion of a bait and switch or an oversell of how far UCSF has gone in anti-racism, which is quite far, especially compared to peer institutions, right? But it's not all the way, because after all, we are in the United States, and even though we're UCSF in San Francisco, in California, we are in the United States. Racism is alive and well. And so I think that this fear of getting it wrong is hampering people's courage in trying to do the right things. So finally, I want to share in my remaining few minutes 3 frameworks and then some specific recommendations. So that's just kind of across the board, some of my observations, not all of them, but I only had a little bit of time. I would like to propose for your consideration my definition of racism, which is that racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And those who have heard me speak know I could speak 10 minutes on this slide, but I do not have that time. The second framework or definition is even broader than racism, which is one system of structured inequity, but it's a definition of health equity, a three-part definition. What is it? How do we get there? And how is it related to health disparities? Where I define health equity as assurance of the conditions for optimal health for all people as a process, not just as an outcome that we might magically hit last Sunday and then we feel like we're done. To get there, there are at least three principles. We need to value all individuals and populations equally, recognize and rectify historical injustices, and provide resources according to need. And then when you wonder, how is health equity related to health disparities will be eliminated when health equity is achieved. So health disparities are the outcomes that we have been documenting for years, decades, centuries in this country by race and ethnicity, as well as by other axes of inequity. Those will be eliminated when health equity is achieved, when we are assuring the conditions for optimal health for all people. Finally, anti-racism, because after all, the anti-racism initiative is about anti-racism. And so the first thing is to recognize that anti-racism is a process. And I would say it's a process with at least these three tasks: to name racism, because you have to name a problem in order to get started on the solution. But as necessary as naming racism is, it is insufficient. We must move to action. So the second of the three tasks is to ask the question, how is racism operating here in all of our domains, even in our child's daycare, in our communities? To do a landscaping, to identify levers for intervention, targets for action. And you answer that question by looking at structures, policies, practices, norms, and values, which are actually the elements of decision-making. Structures, the who, what, when, and where of decision-making. Policies, the written how of decision-making. Practices and norms, the unwritten how of decision-making, and values, the why. And then once you've done that landscaping, then we need to organize and strategize to act, because collective action is power. Indeed, we do have individual power that varies by where we sit in hierarchies and in places and how much courage we have, but we have individual power to use our own tools and to do agenda setting and all, but collective action protects us, propels us, it informs us, it inspires us. That is the most significant power. The thing to know about this is that even as UCSF has done a lot of naming racism, a little bit more in different pockets of asking how is racism operating here. So Vice Chancellor Gore, I'm so amazed that you have taken that within finance and administration. And then some organizing and strategizing to act with the Differences Matter initiative and the Anti-Oppression Curriculum Initiative in the School of Medicine and so many other things across the UCSF health equity processes and all. But even if everybody at UCSF gets through all three of these tasks, which are sequential, you have to name, then ask, what am I supposed to do, and then do it. They are also iterative. You will not be done when all of UCSF has gotten to step 3. We need to then ask, we need to name racism again, ask how is it still operating here? What things that I did have been undone? What did we not address before? And continue to organize and strategize to act. So we should not be asking 6 years from now, oh, are we still doing anti-racism? Because our anti-racism efforts will span generations, but we must act now with our power and our tools, because we have to be willing to plant an acorn today so that our grandchildren can have shade. So finally, very quickly, my recommendations. First is that we use this question, how is racism operating here? Looking at the different elements of decision-making, the who, what, when, where, how, and why of decision-making, to identify targets for action across all of UCSF, and that we also make our institutional walls more porous, not just the exterior walls, UCSF and the surrounding community, but our interior walls between the different schools, between the campus and the health system, between the different entities that are involved in the training of our folks, as well as the UCSF health system. We need to make an inside-outside strategy more feasible across all different levels of our institution, our interior and exterior walls. We need to move everyone at UCSF from valuing comfort to valuing social justice. There's almost a polar tension between those who value comfort and those who value social justice. We need to move all of our people to valuing social justice, recognizing that valuing social justice in the current status quo will not always be comfortable. So we have to, again, have courage in that way. And we need to confront racism denial, which operates as a huge black hole in our national landscape, much less in the UCSF landscape. So with regard to the UCSF Anti-Racism Initiative, I have 3 hopes for this initiative as I wind down in 2 months from being the UCSF presidential chair. The first is that everybody, all learners, employees, alumni, and members of the surrounding community should know that UCSF has an anti-racism initiative. All of these people should be able to describe the anti-racism initiative, and then all of these people need to know how to enter, how to contribute to the anti-racism initiative. So here is developed with 3 others, Alejandra Rincon, Tiffany Chan, Gabby Negusereta. As we were talking about my first visit in March here at UCSF, we came up with an idea that I'm presenting this way. 10% of everybody's job at UCSF should be devoted to the anti-racism initiative with a specific linkage to one of the focus areas, which are now described as 7 pillars. So not only would everybody know that there was an anti-racism initiative, they would know because it's part of their job, 10% of their job. They would also know how to describe it because they would have to pick one of the focus areas to align their effort to, and they would know how to get in because anything that was going on within that pillar or the whole initiative would be open and welcoming to them. Furthermore, we all proposed that 15% of the unit of each unit's budget goes to that. So 10%, that's for everybody's work, but an extra 5% of the whole budget so that maybe some people are trained to be 50% time to be facilitators for conversations or whatever. So with that, thank you for the opportunity to learn from so many of you, to have really stimulating conversations, and thank you for the opportunity to share my observations and my recommendations.
Thank you very much, Dr. Johnson. We'll have questions, I'm sure, in the next segment of this, but it's my pleasure now to share the results of our UCSF climate survey. And Dr. Jones, your observations, your roadmap, and your call to action are critically important to us. And so we really appreciate that. We know that we're in a continuous equity improvement process and that it is very iterative. And part of the data for us has been generated in this climate survey, which I appreciate the participation of members of our campus community in doing this work. I'll be presenting these data today, but this is a large team effort. I want to specifically call out the 2 co-chairs of the climate survey team, and that's Dr. Elizabeth Ozer and Genevieve Bonville, and they'll be here to help answer questions. But it's my privilege to share a bit with you about what are the goals of our survey as we seek to implement an institutional-wide survey of all members of our campus community to best understand what is the learning and working environment that they're experiencing based on their position as learners, based on their race, ethnicity, and other demographic characteristics, and how have they experienced issues of harassment, discrimination, or been able to partake in particular campus services, initiatives, and resources. We want to obviously identify where we have strengths and build on that, as well as identifying those gaps that are necessary to really propel us to where we want to be. The survey was administered in the fall, among faculty, staff, and learners. It was administered in English, Spanish, and Chinese by Emma White Research, who fully administered the survey such that it would be blinded from those of us on campus as to the survey participants. We were pleased that we had such an amazing response rate in our survey, 14,579 responses, 56% of our faculty, 44% of our staff, and 35% of our learners. And the data were really weighted to match the information about our population overall. And as you see here, that if you look at the response rates, the percentage of the populations are fairly well represented, slight underrepresentation of men in this survey, overrepresentation slightly of trans, non-binary individuals. And you can see down the line that we had a survey that was really reflective of our campus community, and we feel that this is very useful information. We also have data that we didn't have before, unknown about the percentage of LGBTQ plus individuals, individuals with disability. We didn't have great information there, and the survey identified 12% of the respondents identified as being an individual with a disability. So overall, high level, the UCSF climate is viewed positively. Our pride values, they're well known by our community, and that the fact that we've implemented them receives very positive remarks from faculty, learners, and staff. Majority of individuals do feel that they are connected and listened to at university. They also describe our enterprise as being respectful, friendly, and inclusive. However, there are some challenges regarding groups that are historically underrepresented groups, and in particular, African-American, Black individuals, trans, non-binary people, and those with disabilities report that they're less comfortable in the climate at UCSF, and they have experienced higher levels of discrimination. So overall, at UCSF, when we look at our climate, it's viewed very positively by the majority of people, with 70% saying that they're comfortable or very comfortable with the climate at UCSF. Learners actually report the highest level of comfort with our climate, 77%, significantly higher than the 70% overall, and our faculty are least comfortable with our climate. There are variations in the evaluation by the demographic characteristics when we look at trans, non-binary, those with disabilities, and Black African-American individuals. So here by gender, we can see the overall 70%, males are more comfortable at 76%, but here, and women are right at 70%, trans, non-binary 50%, and 66% here for LGBTQ. And you can see for those with disabilities as well. When we look by race and ethnicity, again, with the 70% overall for our campus community, we can see some significant drop-offs for Hispanics, a slight drop-off, but very significant here for Native Americans and Black African Americans, much less comfortable. 72% and Asians are particularly comfortable with the climate at UCSF at 76%. Our campus staff report a more comfortable climate than the climate people are experiencing in the health system, with a 67% in the health system versus 73% on the campus side. And we recognize that this survey was taken during COVID when many of us were working remotely, except for the majority of those in the health system. So there's certainly a new baseline here that we're establishing, and with the caveat that this is the period of time that we were in. We spent a lot of time talking about our pride values at UCSF: professionalism, respect, integrity, diversity, and excellence. And these have been highlighted significantly, and we're pleased to see that, in fact, they are rated as extremely important in a large majority of our community, and that UCSF has a climate that embodies these elements of our pride values. And by rating, excellence is number one here with professionalism. And you can see that it starts to drop off a little bit around issues of respect and diversity. And I think these are critically important issues to inclusion and to diversity. So we'll need to explore those further. Well, UCSF has been on this road for a long time, working both with faculty climate data, our past climate surveys, the Gallup data, to really enhance a culture and a climate of inclusion. And so we want to see whether those initiatives have positively impacted the climate. Individuals feel themselves that they can positively influence the UCSF climate. And two of the initiatives that were most highly valued for faculty, the mentorship program for new faculty, 92% considered it very valuable. Staff value career development opportunities for staff overall, that's a great thing to have. Others value programs like our counseling for sexual and racial harassment. Affordable childcare is highly valued. And then these other attributes of things we're doing: staff recruitment process, diversity and equity training, and you can see down the line. Well, most faculty and learners have mentors, and we can see from this slide that our staff really would like to have mentors. We have some opportunity to improve mentorship and support for staff development. Those who have a mentor are very satisfied with their experience of their mentor, and you can see it reflected here. So COVID, as we all know, has had an impact on all of us, and the staff and faculty discussed the experiences, the negative impact. 69% of our faculty, 52% of our staff report having caregiving responsibilities, and that the COVID has had a negative impact on their abilities to provide that. And when we look more specifically with the question specifically asking, since COVID pandemic, the caregiving responsibilities have negatively impacted me across these areas. And you can see the difference here for our faculty, their productivity, ability to concentrate, work schedule, hours worked per week. So across the board, it's significant for both groups, but certainly more so here when you look specifically at how it's impacted our faculty. So when we start to look at the various kind of groups at UCSF, we asked about whether or not their experience is based on their representation in a particular group, and found some consistency here in a theme that the lowest ratings are among trans, non-binary individuals, those with disabilities, and Black African-American individuals. When we look at gender, women describe a somewhat less positive climate for women than men do for themselves, and this is 67 versus 75%. When you look further, transgender individuals are down at 28% of trans and non-binary people describe a good climate for transgendered individuals. That's opposed to 67 or 70%, so that's significantly less. The LGBTQ plus community is at 69%, pretty consistent with others. Only 32% of those with a disability say that the climate for people with disabilities is good at UCSF. And when describing their own situations, it's interesting to hear that by race ethnicity, whites describe a very positive climate. Asian, East Asian, South Asian, Southeast Asian, and Native Hawaiian Pacific Islander. Starting to disaggregate the Asian communities, you can see that there's some differences by those levels of disaggregation of those data. And then we continue to look further at race ethnicity, that you can see the continued fall off. 50% of Hispanic Latinx people describe the climate overall as good, very good. Middle Eastern, Northern African, again, here are American Indian, Alaskan Natives, and then at the bottom here, African Americans, Black individuals, only 32% describe the climate as good, very good. What about actual experiences of discrimination? Those vary across UCSF with the variation by gender, identity, race, ethnicity, and disability status. 14% of women and 29% of non-binary individuals have experienced gender discrimination. And we asked this question in the last 3 years to make sure that we can put a time. We previously asked this question and it didn't have this time. So this is good, more recent data for us as a campus. And you can see the difference here for non-binary, trans non-binary and women. 9% of LGBTQ plus respondents say that they've been discriminated against based on their sexual orientation. 15% of respondents with disabilities say that they've been discriminated against based on their disability. And this is a bit of a significant difference, that 42% of Black African Americans say that they have experienced racial discrimination based on their race and ethnicity. Last 3 years, discriminated against at UCSF based on your race and ethnicity. And you can see the total overall 14%, and all the minority subgroups. Hispanic, that's significant as well. African Americans, highly significant. So what about exclusionary behavior? And exclusionary behavior is defined as shunned or ignored. So you're kind of isolated because of that, or intimidating, offensive, like you've been bullied or you've experienced this harassing behavior. And when we look at this, we find that women are more likely than men to experience exclusionary behavior. The rates are highest among Native Americans and Black African American individuals at UCSF, and LGBTQ, trans, non-binary people, and those with disabilities are similarly more likely to experience. And by position, staff and faculty are more likely to experience exclusionary behaviors than our learners. And so 24% say that they've experienced this behavior at UCSF in the past year. So that's significant even in and of itself, 24%. So a fourth of our population have experienced this at UCSF. Women, 26% of women versus 19% of men have experienced this. Again, Black African Americans and Native Americans have experienced significant at 40% for a Native American population, 34% for our African American Black population, and it's still significant for Hispanics and multiracial groups as well. LGBTQ in trans non-binary also experience higher rates. Again, 29% for LGBTQ versus straight, and then cisgender versus trans non-binary, you can see 38%, significantly higher. Those with a disability also experience exclusionary behavior at higher rates than those without a disability, 38% versus 22%. And then by position, we find that here our learners are the least likely to experience exclusionary behavior, and it's highest amongst our staff, which are the largest component of our community. And then those who have experienced exclusionary behavior, the position is the most frequent reason why they believe they've experienced this, followed by race and ethnicity, 48% for their position, 32% for their race, ethnicity. And we'll need to look at the intersectionality of what these different positionalities are. Few say that they believe that the exclusionary behavior was actually based on these other factors like their disability, socioeconomic status. So these are good that they're not issues for people relative to the experiences that they're having. Again, more of our health system staff have experienced exclusionary behavior compared to those who work on campus at significantly more, 30% versus 20%. So in summary, the UCSF climate is comfortable or very comfortable for 70% of our community. And the majority actually perceive that we're an inclusive and they are connected to us as an institution. Our pride values are well known and rated positively by the majority, but individuals who are Black, Native American, trans and non-binary, or have a disability are less comfortable with our climate. Women and historically underrepresented groups experience more of this exclusionary behavior, and Black individuals experience far more racial discrimination than any other group. And that the caregiving responsibilities, especially as faculty identified, have significantly impacted individuals during COVID. So we have a lot of next steps to do. We certainly want to make sure that we have transparency with this data, and we will be disseminating the data widely. We'll have a full report and share those results across the university and the health system. We're going to further break the data down by school, learner, staff, faculty groups, and other ways to provide more direct information to those groups. We're going to do an alignment with our Gallup data, which it relates to our staff and other relevant UCSF surveys. We need to address the challenges Our anti-racism initiative is really focusing on addressing anti-Blackness, looking at the structural inequities and experiences of exclusionary and discriminatory behavior. And we know that we need to hone in our focus on both the systemic issues, but also the interpersonal issues that are driving the isolation, intimidation, and discrimination data that we're seeing here. We will be reaching out for engagement with groups and individuals and to participate in the solution finding for this. We want to be porous, as described by Dr. Jones, in having people inform us prioritizing the work moving forward. And we will partner across our institution, recognizing that human resources is working on initiatives around people management and issues around civility. It takes a village to do this work. This is a reflection of the task force membership, who I thank very much for their hard work and commitment over years to get this done, with the co-chairs again, Genevieve and Elizabeth, thank you so much. And further members of the team that helped in gathering data, disseminating data, and really will help us in moving forward and sharing these data across the institution. Thank you. We will at some point have it posted on our website, diversity.ucsf.edu, but we will be working with all of you in order to do that. So with that, thank you for your time and attention, and we will turn it over to Lisa Cisneros, who will facilitate any questions that folks have. And you can turn your cameras on if you're here to answer questions. We have a distinguished panel of individuals available to do so.
Great, thank you so much, Renee. Let's start with a few questions for the Chancellor. One is, can we have these diversity town halls quarterly instead of once per year?
Thank you, Lisa. A great question. We have, in fact, been having diversity town halls quarterly for the last year and a half, Renee. Correct me if I'm wrong. And we will continue to have these on a regular basis. This just happens to be labeled as the Chancellor's Leadership Forum, which is held once a year, but the other town halls have different focuses as we move through the year.
Okay, and I'm going to stay with one more question. Are there any initiatives to address health inequities that involve grassroots organizations in and around San Francisco with similar goals and objectives? Some are driven by UCSF students, and I think will only strengthen UCSF's mission of advancing health.
I love that question, and the answer is yes. But as with many of the questions that are being asked today, we can always do more. I would like to bring to everyone's attention that in 2019, UCSF Health formed a Health Equity Council. It's currently chaired by Dr. Malcolm John, and it has done really phenomenal work over the last 3 years, including throughout the pandemic, to better understand health inequities in our own patient population. We have, to use Dr. Camara Jones' language, we have named these as problems. I get a dashboard report once a month. In fact, immediately after this meeting, I'm going to my Governance Advisory Council for the health system. And we have made strides in many of these areas, but we've got more work to do. In terms of partnering with community, I think it's absolutely the right thing to do. And we have actually, the pandemic has created both enormous opportunities for that and shown the power of those community engagements. Just a couple that I would call out: the Unidos El Sanud, which is the work going on in the Mission District, where we have ongoing testing and vaccination, starting with COVID, but we've now expanded that to diabetes screening and HIV testing. That's touched thousands of people that would otherwise have been left behind. The Umoja Health work that Dr. Kim Rhodes leads in Bayview, Hunters Point, and in the East Bay has been equally powerful in the African-American communities. And again, Malcolm John has done great work with the UCSF Black Health Initiative that partners with, amongst many organizations, but the San Francisco African-American Faith-Based Coalition. So they're just a few examples. And of course, our partnership over many, many years with Glide show the power and the positivity of working with the community. So thank you for that question.
Great, thank you. This one's for Corey Jackson, Chief Human Resources Officer. Is there an effort to look at our HR recruitment processes to align with our DEI efforts? I enjoyed the best practices in diversity recruitment toolkit, but when we tried putting it in practice by being more inclusive in our job requirements, HR put standard languages back in.
I think that's a good point. I think we have to look at some of the language that people took out, because I don't know specifically what that is, but I do think that's an opportunity there for us to continue to work with the Office of Diversity Outreach, other members of the campus community and health system community too as well, to have some of those consistent diversity recruiting efforts going forward. I know recently that our office has worked really well with ODO and try to put some of those things across the entire enterprise and try to standardize some of those things, centralize some of those things. But I always think there's opportunity to improve and to get feedback from people who are trying to really implement them and do things the right way. So any information, please send that to me and Renee, and we'll be able to continue to tweak it as much as possible.
I have one more question for you, Corey. Do you think the pandemic and more staff working from home has made racism worse or slowed our progress?
You know, it's an interesting sort of question in that, you know, some people have said because people have been working remotely, it's harder to have some of the level of interactions that people have in the day-to-day workplace to have some of the microaggressions take place in person. But we all know that microaggressions can happen over Zoom as well. And so it's a really interesting question. I'm not sure the research, at least on our end, has shown that it has made things worse or hindered some of our process. I think sometimes people say it has given them an opportunity, especially people of color, to not have to face some of those day-to-day things that are happening in the workplace. But at the same time, we know that it can be challenging to build relationships that are necessary to move up and around and through the organization too. So I think it's really complex, but it hasn't been shown here in the research so far.
Okay, thank you. This one's for Executive Vice Chancellor and Provost Dan Lowenstein, and perhaps Dean King can also weigh in. Data from the climate survey illustrates that the point that Dr. Jones identified, i.e. Black women leaving UCSF. What strategies would keep us to remedy these causative factors? Do we do exit interviews or collect data when staff faculty leave, particularly those groups where discrimination or exclusionary behaviors are reported?
In terms of trying to understand the reasons for people leaving, yes, we make a concerted effort to have discussions with the faculty who are leaving. And as Dr. King may also share, what we see is it's a mixture. There are some folks who are leaving because they're going to just really great situations for them from a career point of view, and I think the departure of Kirsten Bidmans Domingo is a great example of that. And then we have other folks who have made it really clear that they didn't feel as supported as they would like, and they found other opportunities. So we are trying to understand that, and there's also been an additional, I think, increase in the conscientiousness about the importance of retaining the faculty that we bring here, especially with our most recent efforts to increase the number of faculty that we're recruiting from historically excluded groups. But I think we need to pair the idea of recruitment and retention together all the time. Talmadge, do you want to add to that?
I think that's good.
Okay, great. I'm going to go to Dr. Jones with this. I recently saw a tweet from Crystal Fleming that I'd like to get your reaction to. We don't talk enough about how integration historically meant placing Black and brown people in white supremacist environments. That's still what diversity and inclusion means today. How can we get beyond the performative saying the words to actual structural change?
Well, it has to do with power and resources. So I am all for institution building within our communities, but that doesn't excuse these other historically exclusionary institutions from their responsibility to be right. So it's a both and. I mean, what we need to do is try to get investment in our genius and investment in our ideas and investment in our institutions and in our people across all. So, so even if we had 50 new historically Black, it would be historically newly Black, you know, institutions of medicine and nursing and all, that doesn't mean that UCSF should go, phew, right? So, and I think that part of it is not that we don't understand the loss. We do not understand that when we aren't fully investing in the full excellent public education of all of our kids, because the blinders of racism make us think that there's no genius in the barrios, ghettos, on the reservations, you know, we can get along without those kids. We do not understand how racism saps the strength of the whole society. So it's not a allyship thing or a generosity thing, or okay, we will give you something or we'll bring you in or invest. This is really for the benefit of all of us. And so yes, those people who have been oppressed and suppressed down, if we can allow all of us to express our full potential, that's great for the individuals and the communities, but it's great for the whole society. So it's a retooling of what we're about. We're not trying to just do things for those people or to be politically correct. We're trying to do something for all of us. And yes, we should invest in all of us in all of the different ways.
Great, thank you. This is for Suresh. I have worked at the Oakland campus for more than 18 years. Recently, several of my BIPOC patients and families have shared their observations with me that Oakland inpatient facility is outdated, understaffed, disorganized, and lacking in equipment and supplies. They feel like they're receiving suboptimal care. Can you speak about what practical steps UCSF is taking to ameliorate this obvious disparity between campuses?
Yeah, it's an excellent question. I would say that we're really proud of our entire team and our colleagues across the system, but most notably in Oakland as well. I still think we deliver world-class care there because we have wonderful people that are really committed to all of our patients. And we have a highly collaborative environment, and the results we continue to get at the Oakland Children's Hospital campus are amazing. However, it's not without its challenges. We are very committed to continuing to invest in upgrading the technology available for the patient care there. We continue to have active plans led by Matt Cook to make a difference in those care capabilities on an annual basis. But ultimately, there's no getting around that facility has its challenges, and that long term, we are going to have to make some changes. I've had the opportunity in the 2 months that I've been here to be on the Oakland campus three separate times, and I've personally witnessed some of the challenges associated with the layout, the size of rooms, quality of ORs, various different areas. And before me, Chancellor Hawgood has also had the opportunity to review these same facilities. And here at UCSF, we're committed at the highest levels to bring forward an appropriate proposal to provide an adequate facility solution in Oakland. And I think that we'll have more to say on it this year, just in a few months. But when you make this kind of a plan and an investment, we want to make sure that it's holistic enough to meet the needs of not only the children in the Bay Area this year, but also something that'll stand well over the next decade. And so I think that we're just finalizing that planning. We're very optimistic about doing this. And let it be said, our commitment to all of our settings of care are equivalent, and our ambitions around the excellence that we hope to achieve are equivalent, and that level of investment that we're about to make in Oakland will only further advance that. And we'll be happy to share that in upcoming months.
This next one is for Renee. In using anti-racism as a framework and goal, has UCSF had any meaningful discussions about how white supremacy, capitalism, and settler colonialism are foundational to how racism works? as a means of pure strategy, have we thought of ways to mitigate or dismantle these forces to reach our stated goal of anti-racism?
I almost need you to repeat the question. I think that we have explored the basis for structural racism and how it exists within higher education, within academic environments, and within healthcare settings. We could do more, I am certain of that. We've invited experts and speakers in to kind of inform us about the history as it reflects and relates to those various areas. And I think we are continuing to learn. Our repair project has been a huge step forward for educating ourselves, our campus community, about how race and racism has shown up across these areas, and recognizing the fact that that there is white supremacy and we are in a predominantly white institution, and what that means, and how pernicious the levels of structural inequities can be, I think is really the basis for doing the work that we're doing. I describe the work as an onion. You peel back a layer, there's some tears involved, but then there's another layer in those structures. And as we start to tackle structures of hiring, structures of promotion, evaluation, et cetera, we will continue to uncover these things, and we will continue to iterate around them, while also understanding the deep-seated root of a lot of the things that we're seeing. So yes, we're working on that. We could do more.
Okay, great. These next two questions are for our co-chairs of the climate survey itself. So Elizabeth Ozer and Genevieve Bonville. First one for Elizabeth. How do these statistics compare with the last climate survey? Has there been any notable improvement?
Hi, thanks for your question. So I want to first put in context what the last climate survey is, because we've had a variety of climate surveys. The last one we did that actually was the whole UCSF population, like this one, was the 2012-2013 climate survey that went across the whole UC system. Then we have a faculty climate survey from 2017, and this is taking the place of that faculty climate survey. So we actually have quite a few items that are similar, so that we'll be able to more specifically look at changes among faculty. And I think some of that will certainly be in the report. You'll be able to see much more breakdowns across that. I do want to say, however, that even for that, and then of course we have the Gallup that happen regularly, but is a very different survey. But we will be looking at some of the bigger trends and looking across the surveys, but the questions are not asked in the same way. Now, just to go back to the one that was now almost 10 years ago, we had about 1,450 people answered this survey, as Vice Chancellor Navarro pointed out. About 14,000, about 9,500 answered 10 years ago. So we have different samples. So we kind of have to be careful. I would say a lot of the trends and what we're certainly seeing for the historically underrepresented groups are quite similar. We do see the mentoring, for example, has always been strong. It's even stronger in this survey. One area that really jumps out are lower rates of exclusionary behavior, particularly among staff. Mm-hmm. So in the survey before, we had quite a big differential between staff and faculty. Now it's quite similar. Learners have been consistent at being the lowest. So we're looking more at that. Another breakdown that we're doing is those who've been remote, those who've been hybrid, and those who've been in person. And I think we're actually going to have some really useful data because we are seeing some differences among those groups. And we're really going to be looking across many different variables to see how that's playing out.
Okay, great. And Genevieve, there's a comment on, since the majority of the workforce here is white and able-bodied, wouldn't these values be skewed toward their experience? The experience of non-white staff versus white staff may be incredibly different. Non-white voices, the voices of those who identify as differently abled will always be the minority in these surveys. White and able-bodied colleagues' voices will always be louder and skew the overall findings. What's your reaction to that?
I think if I understood the question correct, I would agree. Yes, the majority of folks are able-bodied and white, and the values will skew towards those. The purpose of sending out a survey like this is to amplify the voices of those who are not and those who are disabled. And as you saw in the data, there is, I think, at least significant exclusionary behavior reported by those who are disabled, and that has to be included in our next steps. We are making some efforts. I mean, I'll say, myself as someone who is disabled, they're not enough. But the first step is to recognize that we have the problem and not make those voices quiet, not have disability be the other thing. The last thing, I think I saw that as one of the other questions. We have so we have some efforts. I'll leave it at that. I don't want to, pretend that we've solved the problem. But we do need to amplify and bring those voices up to the top.
Great, thank you. This one's for Renee. What is the Office of the Prevention of Harassment and Discrimination doing to ensure timely and thorough investigation of these incidents of discrimination?
Thank you, Lisa, for that really important question. And we recognize that there has been an increase in the amount of allegations coming into the Office for the Prevention of Harassment and Discrimination. And part of our process is to restructuring the office to actually change the flow of cases through the office and to add additional investigators. There was some challenges to recruiting people into the position when a lot of our partners in the private sector were recruiting away our really outstanding and well-trained individuals. And so while we work to decrease the number of allegations, I mean, that would be the best outcome ever. If these incidents didn't occur, we're working and hopeful that our education and training, that our bias incident response team and our training of managers would be such that we can prevent things getting to the point where there's an actual allegation. But once allegations are received in the office, we're doing process improvement. We've partnered with J. Michael within Human Resources around business strategies to improve the flow, and we have a new system for managing our cases. So we are working to increase the efficiency. Unfortunately, many of these incidents are longstanding, people finally coming forward, and we identify that issues have been in place for 5 years, and there's 40 people to interview. And so we'll work through that, and we're going to improve our efficiency, but do so in a way that's thoughtful and considerate and includes all of the witnesses that are necessary for these investigations.
Great, thanks. This one's back to Corey Jackson. I did not see any results on pay equity between female and male staff and faculty. This is a real problem that does not get addressed in climate surveys. Also, why do some positions in different departments get paid differently?
Yeah, so the first question, the pay equity. So the pay equity study, there's actually a couple of pay equity studies that aren't included in this that are done both by UCSF individually, then also the University of California in general. And that information has been submitted over the last, I think, 3 or 4 years, and working through some of that. So that's a separate body of work, and that survey information is out there. And there's work to be done to look at some of the equity adjustments that need to be made there. The second part about compensation is probably a more nuanced sort of answer to that, because not all positions are necessarily equal. So I think we have to look at the jobs and look at even people with the same titles. Sometimes jobs aren't the same because jobs evolve over time and things like that. So we kind of have to look at the jobs to sort of compare apples to apples when it comes to those situations, and then make adjustments and corrections where necessary. And sometimes those corrections are made from a compensation perspective, and sometimes it deals with adjusting the job description to reflect the differences in the roles.
Okay, we're down to the last 2 minutes. I'm going to end. This will be the last question to Renee. Love this idea of 10% of everyone's job being devoted to these efforts, but how do we make sure that everyone doesn't then have to work 110% of the time? How can departments be supported to accommodate the time that it takes with the current workloads that we already have?
Well, thank you for that very interesting and challenging question. I think we need to spend some time working through this to identify what 10% of, first of all, can we do this? Is this feasible for us to do as an institution? I would need partnership across the leadership and the institution to get us to that point. But I think then very carefully defining what those roles are and that this is not an add-on. I think that's the situation we're in now. When I talk really to minority individuals or people from these groups who are doing this work because they have a passion for it, because they've experienced the harassment, discrimination, or intimidating behavior themselves, and it's their minoritized taxation, and people are exhausted with that. So I do think we need to start to address it and think institutionally, how are we going to invest in those people who have been doing this work, because it's our institutional responsibility to do this work. And while it's defined in our pride values and it's a part of our performance evaluation, how do we think about writing it into those job descriptions and really, holding people accountable in ways that are consistent with what they can contribute relative to their role. But I really want to thank Dr. Jones and for introducing this idea, bringing this forward as an idea. I think it's something that the Chancellor's executive group will need to work through a little bit more, but that's a great idea for us to think about.
And with that, we're at the end of our program. I want to thank all of our speakers and all of our attendees, and have a great rest of the afternoon.
Thank you all so much. Thank you, Lisa, very much.
Thank you all. Bye-bye.
Bye.